Hi everyone, Dr. Sagar Patel, double board certified Beverly Hills facial plastic surgeon. What I'm here today to talk to you about is ear pinning surgery. So first of all, what is ear pinning or otoplasty surgery? This is a surgery where we can reduce the prominence of someone's ears. For the most part, when people are bothered about their ears, it's not actually about the size, but rather the shape. And this is a surgery where we can change the shape by allowing the ears to fold a little bit closer to the head. Who is a candidate for ear pinning surgery? Almost everyone is a candidate for ear pinning surgery. There is one exception for someone who's not a candidate. For the most part, there's people who have ears that stick out a lot and they don't think about their ears ever. What this surgery really is about not thinking about your ears. So if you're someone who spends quite a bit of time looking at the mirror thinking about your ears, this might be a surgery for you. Now, when it comes down to it, ear pinning is about not thinking about ears. As much as we think it's going to make ourselves better looking, more confident, more successful and smarter, the truth is the human mind very rarely notices what an ear looks like. And what we're doing is a surgery for ourselves in order to think about the ear a little bit less. The person who's not a candidate is someone who obsesses over their ears, someone who wants perfection from their ears. There is no such thing as a good looking ear, no matter how we do the surgery. And if you take the best looking man alive and me, and you put our ears just by themselves side by side, you will not be able to tell the difference, because there is no difference. In all fun, the truth is that what we're trying to do is just get an improvement that allows you the ability to not think as much about your ears. How does an ear pinning surgery work? So the first rule of thumb is this surgery can be done under local anesthesia with one or two exceptions. The first exception being age. For someone who is a little bit older than 9, we can sometimes get away with doing it with just numbing medication, but for most patients younger than that, you need to make sure that you're asleep so it's not too traumatic of an experience. The other two exceptions are really going to be a deathly fear of needles. Even though the shot only takes a minute to numb each side, some people can't handle that. And third of all, people with severe claustrophobia. This is a sterile procedure, so technically your face needs to be covered, and because of that, if you're severely claustrophobic, you might not want to do this in your local. Now for everyone else, there's no issues with pain. There's no issues with seeing what's happening. There's no issues with safety. There's no issues with bleeding. And for that reason, the vast majority of people should have this procedure done awake. Now, why are there so many surgeons who say you need to go to sleep? I bet you the truth is they don't do it that often. The average surgeon knows how to do the surgery. It's all part of our board examinations, whether it's a plastic surgeon or a facial plastic surgeon like myself. We're asked questions about this. We know the book answers. People can always dust off their book and say, I can do an otoplasty. The truth is that is not what makes a good otoplasty surgeon. Experience and dedication to the practice is what's going to get you a surgeon who really knows what they're doing. And to me, the red flag of when someone says everybody has to go to sleep is that that surgeon does not know what they're doing, and that's the only reason they're likely doing that. There's no safety reason involved. What is recovery from otoplasty like? So after the surgery, you'll be wrapped up, you'll go home. The first 2 to 3 days, you can expect some throbbing. This throbbing pain can be controlled by pain medication, and for the most part, you'll have some stitches behind your ear, which you'll have to clean. Now, don't be afraid of cleaning your ears. Follow your surgeon's instructions. What you want to do is make sure you wear what you'll likely be given, which is a headband that helps hold your ears in position for at least a week. I have my patients wear it for 1 week, 24 hours a day, except for when you shower, and 1 week at night to help reaffirm the position and also protect them while you're sleeping. After that, you're good to go. Now, if you have any further questions about the otoplasty procedure, feel free to reach out, leave a comment below. Make sure you like and subscribe to this channel, and we look forward to meeting you soon.